RSV and the RSV vaccine for older adults. Part 2. Everything you need to know about the RSV vaccine. Hi again everybody, and welcome. In the last video, we talked about the disease of RSV, or respiratory syncytial virus. In today's lecture, we will specifically cover the RSV vaccine for older adults. We will review all aspects of the 3 commercially available RSV vaccines and compare and contrast their similarities and differences. First, let's go back and briefly review a few slides from lecture number 1. Again, we will be focusing today's discussion on the RSV vaccine for older adults, not for infants. We now know that older adults, especially those with underlying medical conditions, are at a higher risk of developing severe, sometimes life-threatening RSV infections that can lead to hospitalization and death. Giving the RSV vaccine to older adults helps protect them and reduces their chances of getting a severe RSV infection. This is most important in those older adults with underlying medical conditions such as chronic heart or lung disease, weakened immune system, or those living in nursing homes. Which adults should get the RSV vaccine? The CDC recommends a single dose of any FDA-licensed RSV vaccine for the following adults: all adults aged 75 years and older, and adults aged 60 to 74 years at increased risk of severe RSV disease, meaning they have certain chronic medical conditions such as lung or heart disease, or they live in nursing homes. This is a full list of the chronic medical conditions needed for adults 60 to 74 years old to be vaccinated with RSV vaccine. This list includes adults having underlying health conditions such as chronic cardiovascular disease, chronic lung disease, especially asthma and COPD, severe renal or liver disease, diabetes with complications, functional disability, severe obesity, moderate or severe immune compromise, and residents in a nursing care home. There are currently 3 RSV vaccines licensed by the FDA for use in the United States for adults. They are Arexvy, made by GlaxoSmithKline, Abrysvo, made by Pfizer, and mResvia, made by Moderna. The CDC does not have a preferential recommendation for any specific vaccine. It does not recommend one over the other. Now let's move on to the new lecture material, starting with some important facts about the RSV vaccine. Let's first talk a little bit about the timing of the RSV vaccine. RSV infection is a seasonal illness, most common between October through March. It typically peaks in the winter, December to mid-February. Adults can get an RSV vaccine at any time, but the best time to vaccinate is in the late summer and early fall, before the RSV season. This corresponds to getting vaccinated during August to October. There are 2 major subgroups of RSV, RSV-A and RSV-B. Both subgroups cause disease and can co-circulate or alternate predominance from season to season. What about the number of doses? The RSV vaccine is not currently an annual vaccine, meaning eligible adults do not need to get a dose every RSV season. The need for additional RSV vaccine doses will be evaluated by the Advisory Committee on Immunization Practices, ACIP, and the CDC in the future. Recommendations will be updated as needed. Surveillance and evaluation activities are ongoing. RSV vaccine, co-administration with other vaccines. RSV vaccines can be co-administered with other adult vaccines during the same visit. Limited immunogenicity data show co-administration of RSV with other respiratory virus vaccines, such as a flu vaccine, may result in lower antibody titers, but the clinical significance of this is unknown. Co-administration of RSV vaccine with one or more adult vaccines during the same visit may increase common side effects, such as pain at the injection site, fever, headache, or myalgia. The CDC will continue to monitor vaccine safety and effectiveness to guide recommendations for co-administration. Let's compare and contrast the three RSV vaccines more in depth. As we mentioned before, there are three RSV vaccines currently available. They are Arexvy, manufactured by GlaxoSmithKline, Abrysvo, manufactured by Pfizer, and mResvia, manufactured by Moderna. Arexvy and Abrysvo received FDA approval in May of 2023, and mResvia a year later in May of 2024. Arexvy and Abrysvo use a traditional platform using recombinant RSV protein antigens, similar to the flu shot. mResvia, on the other hand, uses nucleoside-modified mRNA encoding of the RSV protein antigen, similar to the COVID vaccine. As we previously discussed, the CDC recommends RSV vaccine for all adults 75 years and older and adults 60 to 74 years old with certain underlying chronic medical conditions. As you will see in the next slide, the FDA indications differ somewhat to the CDC guidelines. In contrast to the CDC, all three vaccines have been FDA approved for use in all adults older than 60 years old. This blanket age group differs from the CDC, who stated that medical conditions are required for those aged 60 to 74. Also, in contrast to the CDC guidelines, both Arexvy and Abrysvo have FDA-approved indications for use in persons younger than 60 who have risk factors. Arexvy from 50 to 59 years and Abrysvo from 18 to 59 years old. CDC guidelines currently do not recommend the RSV vaccine to be given to anyone younger than 60 years old. Abrysvo has an additional FDA-approved indication for pregnant women. RSV vaccine can be administered to pregnant women at 32 to 36 weeks gestational age during September through January to protect the newborn infant from developing severe RSV infection. This is also a CDC recommendation. So you can see that these expanded FDA indications for the RSV vaccines differ from the current CDC recommendations. Let's have a sidebar and discuss the CDC ACIP versus the FDA. Why do the RSV vaccines FDA-approved indications for older adults differ with what the CDC recommends? It's because the CDC listens to the ACIP rather than to the FDA. What is the ACIP and why is it so important? The ACIP is the Advisory Committee on Immunization Practices. The ACIP makes recommendations to the CDC on how FDA-approved vaccines should be incorporated into the U.S. adult and pediatric immunization schedules. The ACIP's recommendations for a vaccine may differ from the FDA-approved indications, as we have seen. Initially, when Arexvy and Abrysvo were approved by the FDA in the summer of 2023, the ACIP recommended that adults 60 years and older should be vaccinated. However, in June of 2024, the ACIP revised this recommendation and now recommends RSV vaccination as a routine immunization for adults 75 years and older and as a risk-based immunization for adults 60 to 74 years. This is now what the CDC recommends, even though it differs with the original FDA-approved indication for the vaccines. Also in June of 2024, the CDC held off on recommending use of the RSV vaccine for adults under the age of 60. So even though Arexvy is now FDA approved for adults 50 to 59 years old who are at increased risk of RSV lower respiratory tract disease, ACIP judged that insufficient evidence was available to recommend an RSV vaccine in adults under age 60 and did not hold a vote. ACIP stated they will review evidence and provide recommendations to the CDC on RSV vaccination policy in this age group when additional data are available. All three RSV vaccines work by introducing an inactivated RSV protein into the body, where it fuses to host cells and stimulates the immune system to recognize the actual RSV virus if and when it encounters it, and helps prevent severe disease. They induce an immune-mediated antibody response. The mechanism of action in pregnant women is that Abrysvo stimulates production of antibodies to RSV antigens. These antibodies from the pregnant mom are transferred transplacentally to protect the infant against severe RSV infection. For all three RSV vaccines, efficacy is approximately 80% in preventing severe RSV infection. The dose for all three RSV vaccines is 0.5 ml intramuscularly. The preferred site of administration is the deltoid region of the upper arm. RSV vaccine should not be given intravenously, intradermally, or subcutaneously. Reconstitution of the three RSV vaccines differ. For Arexvy, 2 vials are used to reconstitute the vaccine to produce a suspension. Abrysvo is available as a kit with a syringe that contains the diluent. A vial adapter is used to aid in mixing the vaccine to produce a clear and colorless solution. mResvia comes as a handy, pre-filled, ready-to-use syringe that does not need to be reconstituted. The form is a suspension. Storage before reconstitution. Arexvy and Abrysvo are to be stored in the refrigerator, while mResvia is stored in the freezer. After thawing, the pre-filled syringe of mResvia is stable for 90 days in the refrigerator. Stability after reconstitution or removal from the refrigerator. After reconstitution, Arexvy can be stored refrigerated or at room temperature, and Abrysvo stored only at room temperature. Both should be discarded after 4 hours if not used. After removing the mResvia syringe from the refrigerator, it should be kept at room temperature for 10 to 20 minutes before administering. mResvia can be kept at room temperature for 24 hours and discarded after that if not used. Side effects. All three vaccines can cause injection site pain, redness, and swelling. Fatigue, fever, headache, nausea, diarrhea, and muscle or joint pain can occur. These side effects are usually mild. Guillain-Barré syndrome. Guillain-Barré syndrome, or GBS, is a rare disorder in which the immune system attacks nerves, causing symptoms such as muscle weakness and sometimes paralysis. Based on post-marketing case reports, the FDA reported an increased incidence of Guillain-Barré syndrome occurring after patients received Arexvy and Abrysvo, but not mResvia. Other significant side effects have occurred with the use of RSV vaccine. Atrial fibrillation occurred more often than placebo in patients receiving Arexvy and Abrysvo, but not mResvia. Arexvy may be associated with a greater incidence of adverse events due to the adjuvant component of the vaccine, the same adjuvant that is used in the recombinant zoster vaccine, which is known for causing reactions. mResvia was associated with more axillary swelling and urticaria than placebo participants. Do not administer RSV vaccine to a person with a history of severe allergic reaction, such as anaphylaxis, to any component of that vaccine. Healthcare providers should assess the potential risk of adverse events of each vaccine independently. Summary. In Part 2, we named the 3 currently available RSV vaccines. We defined in which months it is best to receive the RSV vaccine. We listed how many doses of RSV vaccine a person should receive. And we compared and contrasted the 3 currently available RSV vaccines in terms of type of vaccine, FDA indications, mechanism, efficacy, dose, storage, and side effects. We've got a lot in store at the PharmEasy Tutor channel. There will be upcoming talks on drug overdose, electrolyte management, insulin products, atrial fibrillation treatment, and much, much more. So please stay tuned to us. Thanks for tuning in to watch this installment of the PharmEasy Tutor. I hope you learned something that you could use at school or in practice. If you would like to continue to see more of these types of tutorials on YouTube, please make sure to click on the black subscribe button below to change it to the word subscribed. Also, if you like this video, I would appreciate it if you can click on the thumbs up icon below to change the color to black. Also, if you have any comments or questions, please feel free to add them in the comments section below or share the site with someone else. Stay tuned to the PharmEasy Tutor channel for more lectures in the upcoming weeks. So until next time, remember to take it easy.